This is an off-the-chart special bulletin. Welcome to an off-the-chart with Medical Economics Special Bulletin. I'm your host, Keith Reynolds, and today we feature something a little different. I'll be sitting down with Medical Economics Editorial Director Chris Mazzolini to discuss the 95th Physician Report. It's one of the longest-running physician surveys in the country, and every year brings new insight into the realities of the business of healthcare. So, hi, Chris. It's a pleasure to have you here today.
Thank you,
Um,
thank you,
I,
Keith. This is my favorite podcast.
I'm very glad. I'm very glad as you're the one that keeps it running. Tell me, what is this physician report I keep hearing about?
Yeah, I'm glad you asked. So the physician report it's an annual survey that we do to sort of gauge the state of doctors in the United States, the how the medical profession is faring uh, for a variety of topic areas. We're looking at how much they're getting paid. We're looking at the financial state of their practice, the challenges that they're experiencing. We ask them about how things have gone since COVID-19, how much they're using telehealth. It goes on and on. Heck, I'll talk about this a little bit later, but we ask them, would they recommend their children go into medicine, which is always a kind of a spicy answer. So we've been doing this survey for 95 years now. So it's got to be one of the longest running surveys like this of physicians in the country. I don't know if that's actually true, but it's got to be close. And we do this every year. So the data that we'll be talking about during this is actually for the calendar year of 2023. So just, anyone listening, keep that in mind as you hear about this report.
So yeah, you mentioned the data. So what are, some of the big findings this year?
Yeah, so I'll just mention a few, and then I'll share later where they can go to learn more about and view all of the survey data. So some good news and some bad news. The good news is that salaries are up for the primary care physician specialties. So we're talking family practice, internal medicine, obgyn, pediatrics, cardiology, all the ones that are sort of have that relationship bent to their patient physician relationships. So their salaries are up about 4% in 2023 compared to 2022. Some bad news: practice finances continue to struggle. The data actually shows, based on our survey respondents, that it was the worst year for practice financial performance since the COVID year in 2020. And that was a really bad year for practices, as they weren't seeing patients in person at all. It's largely due to rising cost inflation. We've been hearing a lot about that just in the general media. Salaries for staff members, like I said, general price increases and declining reimbursement rates, particularly Medicare, has been sort of putting the squeeze on practices for the last few years. And one other thing on the COVID note is I mentioned earlier that we asked how the practices have done since the COVID-19 pandemic. And we kind of think of the pandemic as over and done. It's like ancient history. It's 2020. It might as well have been 100 years ago. But for the practices, they are still reeling from the huge sort of financial shock that the pandemic was. One of the notes, and I wrote it down here, is that 44% of practices that we surveyed told us that they're worse off today than they were before COVID. So that's a huge number that still is basically digging out of a hole from 2020. So I would say that those are some of the main highlights from this year's data that they really stuck out to me.
So, you got any interesting trends that you've noticed over the past couple of years?
Yeah, so I guess the first thing, and I always say this whenever people ask about comparisons between the years, is that, any trend data of comparing like, what happened one year to another year is all purely anecdotal. Because, different people every year are taking our survey. It's sort of an apples and oranges comparison. So that being said, I do think you can sort of detect the vibes, especially when you look over a long enough, span where you can definitely see some trends that carry over, from one year in the past into, the current iteration of the survey. So, I've been working personally on this survey for 10 years. And like you said, I will work on it for another millennia after this. The one that's really, like, on a serious note, the one that's really surprised me is how stubborn the gender pay gap between men and women it has been. So I looked up, as I was prepping for this, I looked up, what the gender pay gap was in 2013, which was the first year I worked on this survey, and it was 85,000. Obviously, that's an eye-popping number. So what that's saying is that in 2013, that male physicians on average made 85,000 more than women physicians, which, is that's something. In our latest survey, the gap was 55,000. So like there has been progress, but like especially with how many women are now becoming physicians, especially in the primary care fields, it's still wild to me that number is so is such a huge gap. So that's one. Another one I mentioned at the top about how, we ask physicians whether they would recommend their child go into medicine. So 10 years ago, I look back at this one too. And 10 years ago, the vast majority, it was like, over 60% said yes, they would definitely recommend to go into medicine and go into the same specialty. This year, only about a third said that they would recommend their child go into medicine. And, we've kind of plumbed into this data in the past, and we've noticed it really varies by specialty. There's some specialties, I think anesthesiology was one of those where, 90% said. So like some specialties have these very high rates of, oh yeah, it would be great if my child followed me into the medical field. While other ones, and it's primarily the primary care fields, family medicine, pediatrics, internal medicine, where the doctors are telling us that no, I don't know if I would recommend they follow into my footsteps that closely, which is really, surprising. I mean, it is and it isn't. When you think about the challenges that the doctors, who read medical economics and who might be listening to this are dealing with, from all the red tape, the prior authorizations, the payer contract stuff, uh, quality metrics, all of the stuff that they have to deal with, plus the fact that, it's becoming more challenging to run a private practice and not, sell out to a hospital system or a private equity firm. So, so it's like really surprising to hear that, but at the same time, when you start thinking about, the kind of things that, Keith, we're covering on a regular basis at medical economics, that, maybe it's not as surprising. It's a shame. And, I think, we're trying to do our part as a publication to, give doctors good advice to make being a physician easier than maybe it's been in the last, decade or so. And we'll continue fighting that good fight. But yeah, I think those are some of the trends that I've noticed.
Where can our listeners run into the results of this survey?
Yeah, so the full survey went live in July, late July, I think, on medicaleconomics.com. And we'll put a link in the show notes just so that you can anyone can click it and view the data. I will note that we do require free registration to view to get full access to all the data. Which it'll take just a moment, and I recommend it. I mean, it's like 85 slides of just, pure data goodness about what's going on in the medical profession. So that's one way. Another way is we actually have a live webinar event scheduled for September 12th. That's our live virtual Practice Academy learning event. During that event, where we're going to have 4 different sessions covering a bunch of useful information for doctors, some malpractice defense tips, some coding, reimbursement stuff. And in addition to those things, I will be doing a short sort of session where I'm going over the results of the physician report in more detail. And so we'll also include a link to register to that event in the show notes. And that, again, is also free registration. So yeah, those are probably the best ways to get your hands around this data, which I highly recommend.
And that's if you've not had the honor of attending a Christopher Mazzolini seminar, buckle in, folks. It's a sight to behold. Yeah, if you thought this was uncomfortable, check it out.
We're ready
All
to
right.
rock and roll, Keith.
Definitely. All righty, Chris, it's a pleasure to talk to you as always, and thanks for coming.
Yeah, thanks very much. Appreciate it.
Again, that was Medical Economics Editorial Director Chris Mazzolini discussing the 95th Physician Report. If you look in the show notes, you'll see a link to the full report, as well as a link to sign up for the webinar he mentioned. My name is Keith Reynolds, and on behalf of the whole Medical Economics team, I'd like to thank you for listening and ask that you please subscribe to the show on Apple Podcasts and Spotify. If you'd like a digest of the best stories Medical Economics publishes delivered straight to your email 6 days a week, subscribe to our newsletter at medicaleconomics.com. Thank you, and have a great holiday.